To begin, you want to make sure you have all of your armamentarium out on your tray. You're going to need a forceps, mirror, syringe, short needle, anesthetic, topical, cotton swabs, and not pictured, an alcohol wipe. Let's begin by putting together our syringe. Start by taking the alcohol prep pad and wipe the rubber diaphragm on the anesthetic. Next, grab your syringe and with the large window facing you, draw back the handle and place in the carpule. Hit the thumb rings a few times to engage the harpoon with the rubber plunger in the carpule. Carefully take off the cap on the bottom end of the needle. Insert into the syringe until the triangle on the needle, which represents the bevel, is facing toward the small window on the syringe. Now you're going to open up your topical and use a cotton swab to apply a small amount of topical onto your patient's tissue. Next, dry off the patient's tissue where you're going to be placing the topical and place the cotton swab directly on the top of the insertion site, in this case on the mucobuccal folds between the apices of the premolars. Using proper technique, carefully remove the cap off of the needle. Coming from a 12 o'clock position, come over the top of the patient's nose and find a comfortable fulcrum. In this case, the clinician is using her thumb and pinky as a stable fulcrum. As you retract the patient's cheek, insert your needle at a parallel angle to the long axis of the tooth at the mental foramen, which is most normally located between the premolars and the mucobuccal fold. When in doubt, look at a premolar PA radiograph to know exactly where the mental foramen is located. Once you have arrived at depth and angle at 5 to 6 millimeters, you can now aspirate twice and deposit 0.6 milliliters of anesthetic over 20 seconds. You can now safely withdraw your needle. If you are completing a mental injection, you are now done. If you are wanting to complete an incisive injection, put your finger on the patient's cheek where you have just given the injection. Do this for 3 to 5 minutes to backflow the anesthetic into the foramen to cause pulpal anesthesia. You have successfully completed approach 1. You can now safely recap your needle. Sitting at 8 o'clock position, insert the needle at a parallel angle to the occlusal plane, 1 to 2 millimeters before the apex of the first premolar within the mucobuccal fold. Insert the needle to 5 to 6 millimeters of depth, aspirate twice, and deposit 0.6 milliliters over 20 seconds. In this case, the clinician got a positive aspiration and safely withdrew the needle without depositing. The clinician would then insert a new carpule of anesthetic before giving the injection again.